The emergency room was packed, but Dr. Richard Harrison thought he had everything under control. Until Nurse Maria Johnson made what he considered a suggestion about a patient's treatment plan. In front of a room full of medical staff and patients, Dr. Harrison decided to remind everyone about hospital hierarchy and who really made medical decisions. His words were sharp, dismissive, and designed to humiliate a nurse who'd served the hospital with distinction for 12 years. What Dr. Harrison didn't know was that the elderly patient in bed 7, the one quietly observing every word of his unprofessional outburst, was someone whose opinion on leadership, respect, and character carried weight that would change Dr. Harrison's career forever. Welcome to Hidden Valor Stories. Before we continue this powerful story of professional respect, hidden authority, and the moment when arrogance met accountability, tell me in the comments which city you're watching from today. And if you believe that true leadership is measured by how we treat others, hit that subscribe button and help us share stories that matter. Metropolitan Hospital served downtown Atlanta's diverse population with 400 beds, a level 1 trauma center, and a reputation for excellent emergency care. The hospital employed 2,000 staff members ranging from world-class surgeons to dedicated support personnel who kept the facility operating 24 hours a day. Dr. Richard Harrison had been the senior attending physician in emergency medicine for 8 years. At 42, he was competent, efficient, and successful by most professional measures. His patient outcomes were good, his clinical knowledge extensive, and his ability to manage complex medical emergencies well regarded by hospital administration. However, Dr. Harrison's management of staff relationships was less impressive. He had a reputation for being demanding, dismissive of input from nurses and support staff, and prone to using his position to assert authority rather than encourage teamwork. Nurse Maria Johnson represented everything Dr. Harrison seemed to resent about modern nursing. At 34, she had 12 years of emergency room experience, a master's degree in nursing, and additional certifications in trauma care that exceeded those of many doctors. Her clinical competence was exceptional, her patient advocacy strong, and her collaborative approach to medical care respected by colleagues who understood the value of experienced nursing judgment. Most importantly, Maria treated every patient with the same professional competence and personal dignity, regardless of their background, insurance status, or ability to pay. General Patricia Hayes, U.S. Army, retired, had not intended to spend her Tuesday morning in an emergency room. At 67, the former 3-star general maintained excellent health through regular exercise, routine medical care, and the disciplined lifestyle that had characterized 30 years of military service. But a minor cooking accident in her kitchen had resulted in a deep cut on her hand that required professional medical attention. Rather than call her personal physician and wait for an appointment, General Hayes had driven herself to Metropolitan Hospital's emergency room for what she expected would be routine treatment. General Hayes was dressed in civilian clothes, jeans, a simple blouse, and comfortable shoes, with nothing to indicate her distinguished military career or the senior leadership positions she'd held in the Army. To hospital staff, she appeared to be an ordinary older woman seeking medical care. She'd been assigned to bed 7 in the emergency room's treatment area, waiting for a doctor to examine her injury and determine if stitches were needed. From her position, General Hayes could observe the emergency room's operations, and what she saw impressed her. The nursing staff worked with professional competence under challenging conditions, managing multiple patients while maintaining quality care. The collaboration between doctors and nurses reflected the kind of teamwork General Hayes had valued during her military career. Until Dr. Harrison arrived for his shift. Dr. Harrison began his Tuesday shift with the usual review of patient cases and consultation with the nursing staff about treatment priorities. The emergency room was busy but manageable, with the kind of routine medical emergencies that defined urban hospital care. Maria was updating Dr. Harrison about a patient with chest pain symptoms when she made a clinical observation that proved controversial. Mr. Peterson's EKG shows some concerning changes since admission. His cardiac enzymes are elevated, and I think we should consider moving him to cardiac monitoring rather than waiting for the scheduled follow-up. Dr. Harrison looked at Maria with the expression of someone who'd been interrupted by someone who didn't understand their place. "Nurse Johnson," Dr. Harrison said, his voice carrying across the emergency room, "I don't recall asking for your diagnostic opinion. Your job is to follow orders, not make medical decisions." Maria maintained her professional composure. "Dr. Harrison, I'm not making diagnoses. I'm sharing observations about changes in patient condition that might require attention." "What might require attention," Dr. Harrison replied, raising his voice, "is nurses remembering their role in this hospital. I'm the doctor. You're the nurse. I make medical decisions. You follow instructions. Is that clear?" The emergency room had gone quiet. Other staff members stopped their work to observe an interaction that was becoming uncomfortably public. Dr. Harrison was not finished asserting his authority. "Nurse Johnson," he continued, ensuring his voice carried to everyone in the treatment area, "this is exactly the kind of overstepping that creates problems in medical care. You don't have the training, the experience, or the authority to make clinical recommendations. Your suggestions aren't helpful. They're disruptive." Maria felt her face flush with embarrassment, but she maintained her professional dignity. "Dr. Harrison, I'm sorry if I overstepped. I was only trying to share information that might be relevant to patient care." "What's relevant to patient care," Dr. Harrison said, "is having nurses who understand their limitations and respect medical hierarchy. Perhaps you've forgotten that your job is to carry out medical orders, not question medical decisions made by actual physicians." The words hung in the air like a toxic cloud. Other nursing staff looked down at their work, uncomfortable with witnessing a colleague's public humiliation. Several patients, including General Hayes, observed the interaction with expressions ranging from discomfort to disgust. Dr. Harrison seemed satisfied that he'd made his point about hospital hierarchy and appropriate professional behavior. He was wrong. General Hayes had been listening to Dr. Harrison's performance with the analytical attention she'd developed during 3 decades of evaluating leadership under various circumstances. What she'd witnessed wasn't medical supervision. It was unprofessional behavior that revealed significant problems with Dr. Harrison's character and judgment. As someone who'd spent years developing junior officers, managing diverse personnel, and creating environments where competent people could contribute effectively, General Hayes recognized both exceptional professionalism and its complete absence. Nurse Johnson had demonstrated clinical competence, appropriate concern for patient welfare, and professional dignity under inappropriate pressure. Dr. Harrison had demonstrated insecurity, poor judgment, and the kind of leadership failure that undermined organizational effectiveness. General Hayes had seen enough incompetent leaders during her military career to recognize the type. Dr. Harrison was using his position to compensate for personal inadequacies rather than encouraging the kind of collaboration that improved outcomes for everyone. When Dr. Harrison approached her bed to examine her injury, General Hayes was prepared for the conversation that would follow. "Good morning," Dr. Harrison said, reviewing General Hayes's chart. "I'm Dr. Harrison. I understand you have a laceration that needs attention." "That's correct," General Hayes replied, extending her injured hand. Dr. Harrison examined the cut with professional competence. "This will need sutures. The wound is clean, so we can handle this here rather than requiring surgical consultation." "Thank you, doctor." As Dr. Harrison prepared the suturing equipment, General Hayes made an observation. "Doctor, I couldn't help but notice your interaction with the nurse earlier. That seemed unnecessarily harsh for someone who was trying to help with patient care." Dr. Harrison paused in his preparation. "Ma'am, hospital operations require clear authority structures. Nurses need to understand their role." "I see. What do you think that nurse's role should be?" Dr. Harrison was surprised by the question. Most patients didn't engage in discussions about hospital management. Nurses should follow medical orders and carry out assigned duties. They shouldn't question medical decisions or make suggestions beyond their training. General Hayes nodded thoughtfully. "That's an interesting perspective on leadership and teamwork." As Dr. Harrison began suturing the wound, General Hayes continued her evaluation of his leadership philosophy. Doctor, in your experience, do competent subordinates ever provide valuable input to senior decision-makers? Dr. Harrison was increasingly puzzled by this patient's interest in hospital hierarchy, but he answered while concentrating on his medical work. Medicine requires clear authority. Patient safety depends on doctors making decisions based on medical training that nurses don't have. Understood. But what if a subordinate has information or observations that might improve outcomes? Should they share that information? They should follow established procedures and respect professional boundaries. General Hayes was quiet for a moment, processing Dr. Harrison's responses in the context of what she'd observed. Doctor, may I ask about your leadership experience outside of medicine? Dr. Harrison looked up from his suturing. I'm not sure what you mean. Have you ever held positions where you manage people in high-stakes situations? Military service, perhaps. No, ma'am. I went straight from medical school to residency to this position. General Hayes understood. Dr. Harrison's leadership experience was limited to medical hierarchy, which had given him authority without teaching him how to use it effectively. Doctor, General Hayes said as Dr. Harrison continued his medical work, I've spent considerable time in leadership positions where people's lives depended on effective decision-making. What kind of positions? Military command. 30 years, various assignments where successful outcomes required getting the best performance from competent people. Dr. Harrison finished the suturing and began bandaging the wound. That's impressive. Thank you for your service. You're welcome. What I learned during those 30 years is that good leaders encourage input from knowledgeable subordinates rather than discouraging it. Dr. Harrison paused in his work. Ma'am, medical situations are different from military situations. Are they? Both involve life and death decisions, complex procedures, and the need for people with different expertise to work together effectively. General Hayes let that observation settle before continuing. Doctor, the nurse you spoke with earlier demonstrated exactly the kind of professional competence that effective leaders should encourage, not discourage. Dr. Harrison was beginning to realize that his patient was more than a routine emergency room visitor. Ma'am, are you in hospital administration? No, doctor. But I've spent enough time evaluating leadership to recognize it when I see it, and to recognize its absence. Dr. Harrison completed the bandaging and prepared to discharge General Hayes with standard wound care instructions. But she wasn't finished with their conversation about leadership and professional respect. Doctor, may I share an observation about what I witnessed earlier? Dr. Harrison nodded, though he was clearly uncomfortable with the direction their conversation had taken. That nurse demonstrated clinical competence, appropriate concern for patient welfare, and professional dignity under inappropriate pressure. Those are the qualities that effective organizations should reward and encourage. Ma'am, with respect, medical hierarchy exists for good reasons. Absolutely. But hierarchy should enhance performance, not undermine it. What you demonstrated earlier was insecurity disguised as authority. Dr. Harrison felt his defensiveness rising. Ma'am, I'm not sure you understand the complexities of medical practice. General Hayes looked at Dr. Harrison with the direct gaze that had been developed through years of holding people accountable for their behavior. Doctor, my name is Patricia Hayes. I'm a retired United States Army general. I've spent 30 years evaluating leadership in situations where poor judgment gets people killed. I understand the complexities of managing competent people under pressure. Dr. Harrison felt the conversation shift completely. He was no longer talking to a routine emergency room patient. General, I didn't realize. Of course you didn't. Because you judged me based on my appearance rather than my qualifications. The same mistake you made with that nurse. General Hayes continued her evaluation of Dr. Harrison's leadership, but now with her credentials established. Doctor, let me ask you directly. Do you believe that nurses' clinical suggestions were inappropriate? Dr. Harrison was struggling to recalibrate his understanding of both his patient and the conversation they were having. General, nurses should follow established procedures. That's not what I asked. were her clinical observations about the cardiac patient medically sound. Dr. Harrison was quiet for a moment. Her observations were clinically relevant. Then why did you humiliate her for sharing relevant clinical information that could improve patient care? Dr. Harrison had no good answer for that question. Doctor, in 30 years of military leadership, I learned that competent subordinates who care about mission success are assets to be valued, not threats to be suppressed. General Hayes let that principle sink in before continuing. What you demonstrated earlier suggests that you view competent nurses as challenges to your authority rather than partners in patient care. That's a leadership failure that compromises both morale and outcomes. General Hayes had intended to complete her emergency room visit without incident, but Dr. Harrison's treatment of Nurse Johnson had made that impossible. As someone whose career had been built on accountability and professional standards, she couldn't ignore what she'd witnessed. Doctor, I need to speak with your supervisor about what I observed today. Dr. Harrison felt panic rising. General, perhaps I could have handled that situation differently. Perhaps? Doctor, you publicly humiliated a competent professional for doing her job well. That's not a minor management oversight. It's a failure of character that affects everyone who works with you. General Hayes, I apologize if my management style seemed... Your management style? Doctor, this isn't about style. It's about respect, professionalism, and creating environments where competent people can contribute effectively to patient care. General Hayes gathered her discharge paperwork and prepared to leave. I'll be speaking with hospital administration about what I witnessed. Not to cause problems, but to ensure they understand how their patients perceive the professionalism of their staff. Dr. Harrison realized that his moment of asserting authority had been observed by someone whose opinion would carry significant weight with hospital leadership. General Hayes requested a meeting with Metropolitan Hospital's Chief Medical Officer, Dr. Sarah Chun, to discuss her emergency room experience. As a retired general with extensive leadership experience, her observations about hospital staff interactions would be taken seriously by administration. Dr. Chun, General Hayes said during their meeting, I want to share my observations about the emergency room staff and their approach to patient care. Of course, General Hayes. We value feedback from patients, especially those with your leadership background. General Hayes described the incident she'd witnessed, focusing on the professional competence demonstrated by Nurse Johnson and the inappropriate response from Dr. Harrison. Dr. Chun, I've spent 30 years evaluating leadership under pressure. What I witnessed was a competent professional being humiliated for providing relevant clinical input. That's not just poor management. It's the kind of behavior that undermines organizational effectiveness. Dr. Chun listened with growing concern. Patient complaints about Dr. Harrison's interpersonal skills had been increasing, but a detailed account from someone with General Hayes' credentials carried particular weight. General, thank you for bringing this to my attention. We take these issues seriously. I hope so, because that nurse demonstrated exactly the kind of professional competence that excellent hospitals should encourage, not discourage. Dr. Chun initiated a review of Dr. Harrison's professional conduct, focusing specifically on his interactions with nursing staff and overall approach to collaborative patient care. The investigation revealed a pattern of behavior that concerned hospital administration. Multiple nurses reported that Dr. Harrison frequently dismissed their clinical input, created uncomfortable work environments, and used his authority in ways that undermined teamwork rather than enhancing it. Nurse Maria Johnson was interviewed as part of the review process. Her account of the incident matched General Hayes' observations, and her colleagues confirmed that she was consistently professional, competent, and focused on patient welfare. Maria's clinical skills are exceptional, reported the nursing supervisor. Her patient advocacy is strong, and she collaborates effectively with doctors who value nursing input. The problem isn't with Maria's performance. It's with doctors who don't understand how to work with competent nurses. Dr. Chun realized that Dr. Harrison's behavior represented a management problem that affected both staff morale and patient care quality. Dr. Chun called Dr. Harrison into her office for a direct conversation about his professional conduct and approach to staff management. Richard, we've received a detailed complaint about your interaction with Nurse Johnson in the emergency room last Tuesday. The complaint comes from a patient who observed the incident, a retired Army general with extensive leadership experience. Dr. Harrison felt his career suddenly at risk. Dr. Chun, I was managing a clinical situation that required clear authority. Richard, according to multiple witnesses, you publicly humiliated a competent nurse for providing relevant clinical observations. That's not management, it's unprofessional behavior. Dr. Chun placed General Hayes' written statement on her desk. This complaint describes leadership failure that undermines team effectiveness and compromises patient care. Is this accurate? Dr. Harrison struggled to defend behavior that looked increasingly indefensible when described by someone with General Hayes' credentials. I may have been more direct than necessary. Richard, this isn't about being direct. It's about respecting competent colleagues and creating collaborative environments where everyone can contribute to patient care. Dr. Chun delivered the consequences that Dr. Harrison's behavior had earned. Richard, you're being placed on administrative review while we complete our assessment of your professional conduct. You'll attend mandatory training on collaborative leadership and respectful workplace communication. Dr. Harrison realized that his moment of asserting authority had resulted in official scrutiny of his entire approach to staff management. Additionally, you'll apologize publicly to Nurse Johnson for your inappropriate behavior. The same public forum where you humiliated her will be used to restore her professional dignity. Dr. Chun, I understand that I may have handled the situation poorly. Richard, you handled the situation unprofessionally. The question now is whether you can learn from this experience and develop better leadership skills, or whether your approach to staff management makes you unsuitable for senior positions in this hospital. Dr. Harrison understood that his career trajectory had been fundamentally altered by General Hayes' complaint and the investigation it had triggered. What do I need to do to continue working here? You need to demonstrate that you can treat colleagues with respect, value their professional input, and contribute to collaborative patient care rather than undermining it. The following Tuesday, Dr. Harrison approached Nurse Johnson in the same emergency room where he'd humiliated her 1 week earlier. Maria, he said, his voice carrying to the same staff members who'd witnessed the original incident. I owe you a public apology for my inappropriate behavior last week. The emergency room staff stopped their work to listen to what Dr. Harrison had to say. Your clinical observations about the cardiac patient were medically sound and professionally appropriate. My response was disrespectful and unprofessional. You deserve better treatment from colleagues, and I'm sorry for failing to provide it. Maria accepted the apology with the same professional dignity she'd maintained during the original incident. Thank you, Dr. Harrison. I appreciate your acknowledgement. Dr. Harrison realized that Maria's response demonstrated the kind of character that effective leaders should recognize and reward rather than attack. Over the following months, Dr. Harrison gradually learned to work more collaboratively with nursing staff, though his change in behavior was motivated more by career preservation than genuine respect for colleagues. General Hayes received a follow-up call from Dr. Chun, updating her on the hospital's response to her complaint. General, I wanted to thank you for bringing this issue to our attention. Your feedback helped us address a management problem that was affecting both staff morale and patient care quality. Dr. Chun, I hope the situation improved for everyone involved. It has. Dr. Harrison is working on developing better collaborative skills, and we've implemented additional training for all senior staff on respectful workplace communication. General Hayes was satisfied that her intervention had achieved its intended purpose. More importantly, Dr. Chin continued, Nurse Johnson has been recognized for her consistently excellent patient care and professional conduct. She's being promoted to charge nurse in our cardiac unit. General Hayes smiled. That's exactly the kind of recognition that competent professionals deserve. General, your military leadership experience helped us understand how important it is to value the contributions of competent staff members rather than discouraging them. Maria Johnson's promotion to charge nurse in the cardiac unit represented not just career advancement, but recognition of the professional competence that Dr. Harrison had tried to suppress. In her new role, Maria implemented collaborative protocols that encouraged input from all medical staff, creating the kind of team environment where patient care could benefit from everyone's expertise. The most important lesson from this experience, Maria told new nursing staff, is that professional competence should be recognized and valued, regardless of hierarchy or personal prejudices. Her approach to leadership became a model for other departments at Metropolitan Hospital, demonstrating how effective teams could function when authority was used to enhance rather than suppress collaboration. Dr. Harrison eventually learned to work more effectively with nursing staff, though his growth was gradual and motivated primarily by career necessity rather than genuine respect for colleagues. General Patricia Hayes never intended to become involved in hospital management issues during her routine emergency room visit. But when she witnessed unprofessional behavior that undermined both individual dignity and organizational effectiveness, her military background in leadership evaluation made intervention inevitable. Her complaint about Dr. Harrison's treatment of Nurse Johnson demonstrated how hidden authority can emerge to hold people accountable when they abuse their positions or treat competent colleagues with disrespect. The incident reminded everyone involved that professional competence and personal character should be recognized and rewarded regardless of hierarchy, background, or personal prejudices. Most importantly, it showed that true leadership is measured not by the authority we exercise over others, but by how we use that authority to create environments where competent people can contribute effectively to shared goals. So now I ask you, have you ever witnessed someone abuse their authority to humiliate competent colleagues? Have you seen hidden authority emerge to hold people accountable for their unprofessional behavior? Share your story in the comments. Tell us where you're watching from. Because at Hidden Valor Stories, we believe that respect and professionalism should define all workplace interactions, and that competent people deserve recognition regardless of their position in organizational hierarchies. Subscribe if stories like this matter to you. Because every workplace needs people who will stand up for professional dignity and ensure that authority is used to enhance rather than suppress the contributions of competent colleagues.